class. So for this lesson, we're going to tackle your lesson 12, Picornaviridae. So Picornaviridae class is a group of or is a family of viruses that would include two major groups of pathogens, the enteroviruses and the rhinoviruses. Now, whenever you would hear the word entero, this is related to our gastrointestinal tract or the GI tract. So enteroviruses would usually affect the GI tract of humans, while your rhinoviruses, familiar kayo sa rhinoviruses class, this is the common cold, yung sinisipon ka class. Now, enteroviruses are transient habitats of the human alimentary tract and may be isolated from the throat or the lower intestine, while rhinoviruses are associated with the respiratory tract and isolated chiefly from the nose and the throat. Now, these are the properties of your Picornaviridae class. So, the virus would appear icosahedral, 28 to 30 nanometer in diameter, and would contain 60 subunits. It's composed of 30% RNA and 70% protein. The genome of the virus class of your Picornaviridae, they are single-stranded RNA. They have a linear genome, a positive sense. They have a size of 7.2 to 8.4 kilobytes, molecular weight of 2.5 million, and highly infectious genome, contains genome-linked protein known as your VPG. Now, like other proteins class, like other viruses class, they have different types of protein. So picornaviridae, they have four major polypeptides that would be cleaved from a large precursor polyprotein. Then it has your surface capsid proteins VP1 and VP3 are major antibody binding site, while your VP4 is a internal protein. Then there's no envelope class. Replication is in the cytoplasm. Replication is in the cytoplasm. Now, outstanding characteristic of the virus is that the family is made up of many enteroviruses and rhinovirus types that would infect human and lower animals, causing illnesses ranging from poliomyelitis to aseptic meningitis and even to common cold. Now let's take a look at the classification of the Picornaviridae. So the Picornaviridae family class has 12 genera, but we're just going to focus on 1, 2, 3, 4, 5, 6, 6 genuses. So we have the genus Enteroviruses, which would include the enteroviruses and the rhinoviruses. The genus Hepatoviruses, which was discussed last time, yung hepatitis A. Then the genus Cobovirus, we have the Aichi virus. The genus Parechovirus or the Parechoviruses. Then the genus Cardioviruses. Then the genus Aptovirus, known to cause your foot and mouth disease viruses. Now here's the replication of your picornavirus class. So the picornaviruses class would attach to a specific receptor in the plasma membrane. So imagine this is your entire cell. There would be a receptor here. This is where the picornavirus would attach. Then it would enter to the cytoplasm, where it would perform releasing of linear single-stranded RNA into the cytosol. Now, this RNA class is translated to viral proteins. So, itong mga VPG niya. So, it's translated into viral proteins, then transcribed to negative sense single-stranded RNA. Now, the negative sense single-stranded RNA is used as a template to form many positive single-stranded RNA. Viral proteins class would form protomeres. Protomeres would become pentameres. Pentameres are packaged with plus positive sense single-stranded RNA. Then your provirions would be created and would be activated to become infectious virion. Then when the cell lyses, the virions are released. So ito mga nakikita nyo dito class, itong mga 2BC, 2C, yan yung mga different polyproteins, yung mga protomeres and pentameres that are being created. Now let's talk about the classification of virus family. So the enteroviruses class it under enterovirus, the genus enterovirus, we have the different species. Under it, we have enterovirus A, B, C, D, and then rhinovirus A, B, and C. Now each of them class has a genotype name. Your enterovirus A is known as the enterovirus A71. Your enterovirus B is Coxsackie B3. Enterovirus C is known as your poliovirus. Enterovirus D is known as your enterovirus D68. Then rhinovirus A2, B, B14, and C, C15. Then for the genus Parechovirus, we have your Parechovirus A and Parechovirus B. Now, we will be focusing on Parechovirus A. Under Parechovirus A, we have the human Parechoviruses 1 to 16. Then we have the hepatovirus. Under hepatovirus, hepatitis A, aptovirus, the foot and mouth disease virus, and the equine rhinitis A virus. Then under the genus cardiovirus, we have your encephalomyocarditis virus, the tailovirus. So for the tailovirus class, we have the genotype Saffold virus. Let's start with the first one class, yung poliovirus. Now, you're familiar with polio class. Polio class would cause paralysis. Paralysis in the lower limbs. So this is an acute infection class that would affect the central nervous system. When it affects the central nervous system class, there would be destruction of motor neurons. The mouth is the portal of entry. So since the mouth is the portal of entry class, the mode of transmission of the virus is food, via the fecal oral route. And primary multiplication of the virus class would occur in the oropharynx or in the intestine. The virus is regularly present in the throat and even in stools before the onset of illness. So 1 week after infection class, there is little virus in the throat. But virus would continue to be excreted in the stool for several weeks, even though high antibody levels are present in the blood. So even if you have so many antibodies in your blood class, the virus would still be excreted in the stool. Now, the CNS may then be invaded by a way of circulating blood. So poliovirus can spread along the axons of peripheral nerves. Then it would go to the CNS, where it would progress along the fibers of the lower motor neurons, increasingly involving the spinal cord or the brain. Now, take note, class, that your foliovirus does not multiply in muscle in vivo. The changes that occur in peripheral nerves and voluntary muscles are secondary to the destruction of nerve cells. So, ang main effect ng poliovirus nyo, class, its main effect on the central nervous system is that it would destroy nerve cells. While the secondary, yung paralysis class, yung hindi ka na makagalaw, it is just a secondary effect. So the paralysis is just a secondary effect. Now, there are 4 different clinical findings for polio. So the first one is your mild disease. So this is a type of mild polio. This is the most common form of poliovirus infection. So symptoms would include fever, malaise, drowsiness, headache, nausea, vomiting, constipation, and sore throat. Complete recovery class would occur in few days. Then the second type is the non-paralytic poliomyelitis. This is also known as your aseptic meningitis. Same symptoms with mild disease class, but there would be an addition of stiffness and pain in the back and the neck. Disease would last for 2 to 10 days with rapid and complete recovery. Then we have your paralytic poliomyelitis. The destruction of lower motor neurons in the spinal cord would result in what we call flaccid paralysis. Invasion of the poliovirus in the brainstem may lead to incoordination and painful muscle spasm. Maximal recovery would occur in 6 months. Then the last one is your progressive post-poliomyelitis muscle atrophy. So here, class infected individuals would develop paralysis and muscle wasting years after polio infection. Now, in lab diagnosis class, so throat swabs would be taken after onset of illness, and you would also be collecting rectal swabs or stool samples. Uncommonly recovered from the CSF, so you're not able to recover. Rarely mo lang siya nare-recover class. It's very uncommon to recover poliovirus from the CSF, unlike some Coxsackie and ecoviruses. Then culture of human or monkey cells are inoculated, incubated, and observed. Cytopathogenic effects would appear in 3 to 6 days. An isolated virus is identified and typed by neutralization with specific antiserum. Virus can also be identified more rapidly by polymerase chain reaction assays. Now, prevention and control. So, in 1988 class, WHO implemented a global eradication of poliovirus. As of now, class, in the previous year, recent lang, siguro mga 2 or 3 years ago, there were cases of poliovirus again in the Philippines. Dati kasi class wala na talaga siya. Eradicated na siya, considered extinct na siya sa Philippines. But a couple of years ago, there were cases isolated or identified in Mindanao. So ang pinaka-reason nun class is because there was a decrease in polio vaccine. So may mga mothers na hindi nila binibigyan ng vaccine yung babies nila at a young age. So what the WHO did is that they implemented the use of two vaccines. So familiar kayo sa Salk and Sabin vaccine sa immunosero nyo. So the Salk vaccine class is a formalin inactivated poliovirus vaccine administered through injection. While the Sabin or the Sabin polio vaccine is a live attenuated polio vaccine. So if you remember sa immunosera, di ba, kapag attenuated, it refers to the word weakened. So this is a live weakened poliovirus that is administered orally. Now let's go to your Coxsackie virus. So this is a large subgroup of the enteroviruses divided into two. We have your Coxsackie A and Coxsackie B. Most commonly identified causative agents of viral heart disease in humans. They are now classified into HEV groups A, B, and C. Now, the pathogenesis for your Coxsackie, so they would be recovered from blood in the early stages of natural infection. Virus is also found in the throat for a few days early in the infection and stools for up to 5 to 6 weeks. Clinical findings class, the incubation period of Coxsackie virus infection ranges from 2 to 9 days. The clinical manifestation of infection with various Coxsackie viruses range from mild febrile illness to affecting or to causing CNS, skin, cardiac, and respiratory diseases. And these are the Coxsackie viruses class according to their types and associated clinical syndrome. So for Coxsackie virus A class, please take note that there is Coxsackie A virus type 1, type 2, type 3 until type 24. While Coxsackie virus B class has only 6 types. So they would affect the different organ systems. So for the neurologic, there would be your aseptic meningitis. So aseptic meningitis, most Coxsackie virus A would cause aseptic meningitis. And all Coxsackie virus types 1 to 6 would cause aseptic meningitis. For paralysis, 7 and 9, type 7 and 9 for Coxsackie virus A, 2 to 5 for Coxsackie virus B. For encephalitis, for Coxsackie virus A would cause, the types that would cause encephalitis would be type 2, 5 to 7, and 9. While Coxsackie virus B, 1 to 5 would cause encephalitis. Then for the skin and mucosa class, there would be the syndrome known as your herpangina. Now, herpangina class, take note, is characterized by fever and blister-like sores in the mouth and throat. So, Coxsackie virus A types 2 to 6, 8, and 10 would cause herpangina. While we have the hand, foot, mouth disease, Coxsackie virus A type 5, 10, and 16 would cause it, while Coxsackie virus B type 1 would cause it. Then we have the cardiac and muscular. So for pleurodynia and myocarditis, Coxsackie virus B types 1 to 5 would cause this. For the ocular, there would be the acute hemorrhagic conjunctivitis caused by Coxsackie virus A type 24. For respiratory, colds would be caused by Coxsackie virus A type 21 to 24, while it would be caused by Coxsackie virus B type 1, 3 to 5. Then for pneumonia class, it would be caused by Coxsackie virus B types 4 and 5. Then for pneumonia of infants, Coxsackie virus A types 9 and 16 would cause it. Then for gastrointestinal, diarrhea would be caused by Coxsackie type A 18, 20 to 22, 24. Hepatitis would be caused by Coxsackie virus A 4 and 9 type. Then Coxsackie virus B would be caused by type 5. And then we have your undifferentiated febrile illness. Could be caused by all types of Coxsackie virus B. Then we have the generalized disease of infants caused by Coxsackie virus B types 1 to 5. Now take note, class, that the hand, foot, and mouth disease class is not to be confused with the foot and mouth disease of cattle, which is caused by an unrelated picornavirus that does not normally infect humans. So on the left side, class, that is the hand, foot, and mouth disease. So may mga blisters ka sa bibig, sa dila, sa paa, at sa kamay for the hand, foot, and mouth disease. While for the foot and mouth disease of cattle, class, ayan yung itsura niya. So it's only isolated, class, sa ano. So magkaiba yan, ha. Do take note of that. Now lab diagnosis, class. So for Coxsackie virus can be isolated from throat washings during the first few days of illness and stools during the first few weeks. Strains have been recovered from the CSF in aseptic meningitis. Largest amounts of Coxsackie virus A21 is found in nasal secretion. In hemorrhagic conjunctivitis, Coxsackie virus A24 can be isolated from conjunctival swabs, throat swabs, and feces. Then for prevention and control, there are no vaccines or drugs available for it. Symptomatic treatment is given, class. So depende sa symptoms na nagmamanifest, dun yun yung gagamitin. Now let's go to your echoviruses and other enteroviruses. So echoviruses, class, would stand for enteric, cytopathogenic, human, or panviruses. So echoviruses, class, are based on a historical terminology. Were grouped together because they infect the human enteric tract, and they could be recovered from humans only by inoculation of certain tissue cultures. Now they have more than 30 serotypes, but not all have been associated with human illnesses. Many echoviruses, class, have been associated with aseptic meningitis. Rashes are most common in young children. Infantile diarrhea may be associated with some types, but causality has not been established. So let's discuss them. So we have the enterovirus 68 pa. So aside from your echovirus, we also have your enterovirus 68. They share several characteristics with rhinoviruses, including acid lability and lower optimum growth temperature, and have been previously classified as rhinovirus 87. So ang previous name niya, class, sa enterovirus 68 niya before was known as rhinovirus 87. And then we have your enterovirus 70. So enterovirus 70, class, take note, is the chief cause of acute hemorrhagic conjunctivitis. It was isolated from the conjunctiva of patients with this striking eye disease, which would occur in pandemic form from 1969 to 1971 in Africa and Southeast Asia. The virus, class, is highly communicable and spreads rapidly under crowded or unhygienic condition. Then we have your enterovirus 71. Has been isolated from patients with meningitis, encephalitis, and paralysis resembling poliomyelitis. It is one of the main causes of CNS disease, sometimes fatal around the world. There was an outbreak of hand, foot, and mouth disease caused by enterovirus 71, which occurred in China in 2008, and it would involve around 4,500 cases and 22 deaths in infants and young children. It is the most common enterovirus recovered from fecal samples of patients with acute flaccid paralysis in Australia between 1996 and 2004. Lab diagnosis class. So it is impossible to diagnose ecovirus infection on clinical grounds. Ecoviruses are considered in the following epidemic situations. If there is a summer outbreak of aseptic meningitis. So if there's a summer outbreak class of aseptic meningitis, the doctors would consider it caused by ecoviruses. Then summer epidemics, especially in young children, of a febrile illness with rash. So during summer class, if there's a high number of cases of a febrile illness with rash, most likely ecovirus yung nagkakos. Then diagnosis depends on lab tests. So PCR, virus isolation, serological test class are impractical because of the many different viral types. Then you could use neutralizing and hemagglutination inhibiting antibodies. Prevention and control class is avoidance of contact with patients exhibiting acute febrile illness. There are no antivirals or vaccines except for your polio class for the treatment or prevention of any enterovirus. Now let's go to your rhinovirus class. So rhinovirus class are the common cold viruses. They are usually isolated from the nasopharyngeal secretion but could also be found in throat and oral secretions. Now take note class that your rhinoviruses along with your corona, adeno, entero, parainfluenza, influenza viruses are known to cause upper respiratory tract infection. Rhinoviruses are also responsible for about half of asthma exacerbation. So to simplify this, if you have common cold class, most of the time, tapos may asthma ka, your asthma would be exaggerated or lalala yung asthma mo. Now, human viruses can be divided into major and minor receptor groups. So the major group of rhinoviruses class would use the intercellular adhesion molecule ICAM1 as receptor. So yun yung receptor ng mga major group of rhinoviruses class. So dun siya nag-a-attach sa ICAM1. Then the minor group of rhinoviruses would bind members of low-density lipoprotein receptor family. Rhinoviruses are more thermostable and thus they would survive for hours on environmental surfaces. Kaya nga class, it's very easy to acquire rhinoviruses. So kapag may cold ka, sinisipon ka, tinatrangkaso ka, as much as possible, try to avoid touching your nose or sneezing in your hands. Then pathogenesis, so the virus would enter via the upper respiratory tract. High titers of virus and nasal secretion would be found as early as 2 to 4 days after exposure. Then viral titers fall, although illness would persist. In some instances, virus may remain detectable for 3 weeks. Replication is limited to the surface epithelium of the nasal mucosa. So, clinical findings class. So, the incubation period of your rhinovirus is very short, 2 to 4 days. But the illness class would last for up to 7 days. Although a non-productive cough may persist for 2 to 3 weeks. The average adult has 1 or 2 attacks each year. Symptoms class would include sneezing, nasal obstruction, nasal discharge, sore throat. Then other symptoms that would be possible are headache, mild cough, malaise, chilly sensation, little or no fever. Then along with rhinovirus class, bacterial infection could also occur. So secondary bacterial infection may occur, acute otitis media, sinusitis, bronchitis, and pneumonitis. Lab diagnosis class. So antibodies would develop 7 to 21 days after infection. The time of appearance of neutralizing antibody in nasal secretion parallels that of serum antibodies. Antibody may accomplish final clearance of infection. Serum antibody persists for years but would decrease in titer. No specific prevention method or treatment is available, class. The development of a potent rhinovirus vaccine is unlikely because of the difficulty in growing rhinoviruses to high titer in culture, the fleeting immunity, and the multiplicity of serotypes causing colds. Then we have the genus Parechovirus class. So this was defined in the 1990s and would contain 19 types, of which type 1 and 2 Parechoviruses were originally classified as echoviruses 22 and 23. Now, parechoviruses are highly different from enteroviruses in terms of protein characteristics. Parechovirus infections are often acquired in early childhood. The viruses replicate in the respiratory and GI tract. They have been reported to cause disease similar to other enteroviruses, such as mild gastrointestinal and respiratory illness, meningitis, and neonatal sepsis. Now, the human parechovirus 1 was one of the 15 most common enterovirus detections from 2006 to 2008. However, class par ecoviruses cannot be detected by enterovirus-specific nucleic acid typing assays, so it may be underreported. Thus, specific PCR methods are available to detect par ecoviruses in patient samples. Then we have your genus aptovirus. So this is known to cause the foot and mouth disease. This is highly infectious disease of cloven hoof animals such as your cattle, sheep, pigs, and goats, transmitted to humans via contact or ingestion. So in humans class, if you have foot and mouth disease, you have fever, salivation, and vesiculation of the mucous membrane of the oropharynx and skin of the feet. Many cattle class would serve as a foci of infection for up to 8 months. So the if you eat infected cows class, the infection sa cows class would usually last for up to 8 months. So you need to be careful when you buy you meat. When you buy beef, you need to make sure that it is properly cooked. Immunity after infection is of short duration. Formalin treated vaccines have been prepared from virus grown in tissue culture, but such vaccines do not produce long lasting immunity. New vaccines are being developed based on recombinant DNA techniques. Prevention and control of your aptoviruses or the foot and mouth disease is slaughtering all exposed animals and destroying their carcasses. Vaccines could be given to animal. Then strict quarantine can also help control the spread of the virus. Area is not presumed to be safe until susceptible animals fail to develop. Quarantine the herd and vaccinate all unaffected animals. Forbid the importation of potentially infected materials such as meat. So these are the references. That ends the Picornaviridae. Thank you.